added to the public funding part, and with the expansion of the actual cost to $10,000 per person. So 2/3 of the money in our $3 trillion per year health system is public money. It's taxation. Makes us the most taxed nation in the world for healthcare, bar none. Nobody else comes close to what we pay out of our taxes. And on top of that ridiculous amount of money, we put another third out of pocket on the table from our employers and what they put in privately, and from our own pockets in the form of all those various things, the deductibles, the co-payments, the co-insurance, et cetera, point of service payments, all those other things that people pay. All right. This is important information. These are facts that people ought to know. It costs a lot to do American healthcare business this in our usual way. This really ought to be what we talk about. Why is it the case that we spend so much more than any other nation does? And as I've already shown you, have a poor quality experience if measured in the aggregate. Why does that happen? Another way of looking at healthcare spending in the U.S. compared to other first world nations is by saying, what percentage of the gross domestic product goes to healthcare? When I first saw a slide like this, I thought, gee, isn't more better? I was at the Nevada State Medical Association annual meeting, and a doctor actually got up and asked an economist who was speaking and had a slide like this, saying, well, when they give us doctors more money, don't we do good things with it? I mean, isn't it the right thing to happen? Why are we thinking this is a bad thing? This is a good thing. Well, are there economists out here in the class who can answer that question?
Enough to answer the question. It's opportunity cost.
It's an opportunity cost.
Give up something else.
Every dollar spent on healthcare is obviously not spent on something else.
Also, going to say you have diminishing returns too.
Right. The first dollar that's spent on a measles vaccine gets you something. The last dollar spent on the 95-year-old person who got another surgery and died 2 days later, not so much. Okay, that's another good reason. And finally, you cannot have a GDP that's 100% spent on healthcare, right? There's a brick wall here. Is it at 20%? Because we certainly are approaching that. Is it at 25% of the gross domestic product when you hit the brick wall, that your opportunity costs actually sink the rest of your economy? Are we spending less on education and therefore having a terrible educational experience for our primary and secondary students because those public dollars that I'd be paying for that are being spent on healthcare, because healthcare institutions have a much bigger lobbying might and get the money out of the state legislature or the Congress? Where is it that we're going to run into it? Nobody knows, because there is no other nation anywhere near where we are with this incredible devotion of dollars to the healthcare system. Just to put this in perspective, one of the countries that's not on this list is Russia. Russia's per capita GDP is $9,000 per person. That's their total GDP, $9,000 per person. And our healthcare GDP is $10,000 per person. We spend more on healthcare per person than they have to spend for every person in their country for everything. I'm trying to help you understand. We're way outliers on this. This is really ridiculous. This is incredible. Okay. I don't know if I've persuaded anybody yet.